for example, lungs. A lot of people say, you know, if I want to treat other organs, then, you know, the IV the access is a little bit problematic because the cells are going to be trapped by the lungs. And that has been disproven. Temporarily, yes, because the lung is, you know, full of blood. That's an organ of, you know, of oxygen exchange. You need the blood to fully perfuse the organ. So by carrying a lot of blood, then you're carrying a lot of cells. If you have lung pathology, like COPD or some other inflammatory issues in your lungs, yes, a lot of cells are going to be trapped in the lungs. But if your lungs are completely fine and clear, within a few days, they're all going to travel out, and they're going to find other areas of your body that needs help. So, but the beauty about the fact that so much of cells get to the lungs, actually they also get to your spleen, your liver, you know, those, and heart, those are very well perfused areas. But so much is going to get to your lungs. So if you have lung problems, we can just do an IV route. It will get to your lungs beautifully. And this is what we have done in our clinic because the cells are able to travel to the lungs. Can you do nebulizing? Yes, you can, but in certain conditions, you know, coating your lungs with cells may not be the best idea. So in those cases, we may do a nebulizing of exosomes. You know, those are nanoparticles. It's not going to clog, you know, the surface of your lungs, so you're going to be absorbed right away locally. So we can do that. And then another challenging area is the brain, right? Everybody knows about the brain, the blood-brain barrier. How do we get across the barrier? First of all, the stem cells, it is difficult for the cells to cross that barrier. But the mesenchymal stem cells are really cool because they actually have been shown to cross the blood-brain barrier. So they have the ability to squeeze. They're the good squeezers. So they're able to get themselves into the brain. But in our clinic, we also do something that helps open up the blood-brain barrier, such as mannitol, right? It opens up the gap junction. All of a sudden, there's more in and out of traffic because we're giving a lot of fluid, then more cells are going to get in. And there are studies proving that it enhances delivery of stem cells into the brain. And in addition, we can add something that's really cool, which is an intranasal method. So you can intranasally inject stem cells. You have to break the skin barrier, so you have to inject in your nose into the mucous membrane. Unfortunately, that's pretty uncomfortable. So I don't really like doing that. And there's a nice alternative, which is just to use exosomes. We can drip or spray exosomes into the nose, so the nanoparticles can be easily uptaken by the membrane and go across the cribriform plate and get to your nerves and go inside your brain. So we can always use that as an adjunct. So, you know, then that way, you know, we get to this hard to touch region. Besides that, in our clinic, we have also incorporated laser technology. And using laser, we can also direct the cells. So that's third way. You know, we have a lot of ways, right? So we don't want to inject into the organ because that can cause, that's pretty invasive. We have more elegant ways of getting the cells to a particular organ. So it's really fun, right? This is a playground. This is why, you know, this is a kind of cutting edge because we are figuring out ways to get the treatment done and get certain results. And then another area that people, you know, are interested in knowing are joints, right? So if we're just dealing with tendons and soft tissue, that's no problem. We can inject cells right there. But if you're dealing with large joints like the knees or hips, well, the joints are bathed mostly in synovial fluid, and then there's blood supply outside a joint. The problem is if you're trying to fix problem inside the joint, if you're putting the cells in the blood, most of the joint is not getting the signal. So the outer 1/3 of larger joints, the outer 1/3 of the cartilage is nourished by the blood supply. So it can still help. In a sense, I've seen people whose cartilage regrew after IV stem cells. So because the cells are able to, you know, kind of the signals are able to touch upon the outer 1/3 of the joint. And there are stem cells in there. That means that they are triggered or they are prompted to divide and to make new tissue. So you could see tissue regrowth on MRI, which shocked the orthopedic surgeon that saw the imaging because she had never seen that. She was like, I've never seen that in my life. Well, because you didn't have stem cells. I mean, that's pretty simple. So when we're dealing with larger joints, it's good to inject some cells right into the joint space, because all of a sudden the cells are there and then they can go to work. So the combination of the IV and the local injection, I think it produced the best results.